for those kids who get chronic tonsillitis or
Yeah.
chronic throat stuff, can you fill us in on what kind of that might be caused from, what some of the root,
I'm
like,
still learning, right?
okay,
Okay, but this is where I'm at with it as of right now. I believe that if your child is mouth breathing, that is probably the biggest root of why we're looking at adenoids being swollen. Now, there are some people that may disagree with me on that. And again, I'm still learning.
yeah,
Now, granted, it
yeah,
could be possible too that like maybe your baby has swollen adenoids and stuff
mhm,
from birth. And like, I mean, unless you're checking it, how would you know? So it's
right,
kind of like chicken or egg thing at this point. But I'm just
right,
imagining if you're coming out of the womb and now all of a sudden you're breathing air, and we know that there could be things in the air, dust, pollen, if you
mhm,
have any animals, dander, whatever,
mhm,
you're breathing all of that through your mouth. So like
mhm,
people who are having chronic things go on back there, I just happen to think that between the lack of moisture, because
mhm,
the mouth is dry now, and then just possibly those things, they could just be having chronic allergens basically that
okay,
are keeping that from being smaller. Now, if they have obstruction in their airway, that's also going to affect their adenoids, and things can't drain properly. It's
mhm,
going to affect the adenoids. Now, sometimes you can correct the airway and the adenoids will go down. If it's a reoccurring issue within the body and you're not finding a way to be able to help it through these other therapies,
mhm,
it might be time to go ahead and look at removing them.